There are many mistakes that happen in medicine. There are far, far too many medical errors, and my family knows this all too well. We've been touched twice by medical errors. And unfortunately, many medical errors can have life-changing and even life-ending consequences. However, while there are many medical errors, I think it's important for patients and families to understand that there are also times where things go wrong. Things can go wrong in a hospital or a medical setting where it's not an error, where it's not a mistake, where it's not malpractice, where it's nobody's fault. Where the doctors and nurses do their job, but it just doesn't work out. Where the technology does all it's supposed to do, but it just doesn't work out. I chose this topic and put it right at the front of these videos, as well as made it the first chapter in the ebook, Did the Doctor Make a Mistake? Because after doing this work for many years and talking with countless patients and families, as well as many doctors and nurses, I know there's a perception out there among many patients and families that anytime something goes wrong in a hospital or a medical setting, it must be a mistake. Mom's dead, somebody must have screwed up, or our child is not healing, somebody must have made a mistake. And that's unfortunate. That's unfortunate when people get locked in that mindset, because it's not good for anybody, to be totally candid with you. And in doing these videos, in doing this booklet, and putting together this whole educational campaign, I've tried to be very balanced. I've tried to be fair to all sides and cover all the different situations from this end of the spectrum where, hey, it was a mistake, there was an error, there was malpractice. Okay, how do the doctors and nurses, how should they behave in that set of circumstances? And what are some thoughts on how you, as a patient or family, how you might behave? But we cover that end of the spectrum. We got to come over here and cover this end as well, which is, hey, something bad happened, but it wasn't a mistake. There was no error. The doctors and nurses did their job. So again, it's all about fairness. It's all about credibility. I think the path to fairness and credibility starts with helping patients and families understand that when something goes wrong in a hospital, in a medical setting, people are going to be brought in to review the situation to determine if there was a mistake or not. And what they're basically going to do is ask themselves a question. Now, they're going to ask many questions, but the overriding question they're going to ask is, was the standard of care met or not? Was the standard of care met or not? And what the standard of care basically is, in layman's terms, is would a different doctor, with the same set of facts and information and data as your doctor, working in the same context, same space and time, would they have made different choices? Would they have done something differently that might have led to a better result, a better outcome? Or would they have made the same choices as your doctors, gone down the same path and gotten the same results? If they would have made different choices, and the belief is there would have been a much better result, then your doctor may have not met the standard of care, or may have breached the standard of care. There may have been an error. However, if that hypothetical different doctor, if he or she would have done the exact same thing as your doctor, or your doctors plural, then your doctor basically did what they were supposed to do. They met the standard of care. It most likely met the standard of care, and there's probably not a medical error. Instead, it's what is known as a risk or a known complication of the procedure. And I think it's important, I know it's important for patients and families to get a real understanding of these things called known risk or known complications, because, again, coming back to that mindset that many patients and families have, that it's always a mistake. Well, I've seen one too many patients and families who experience one of these known risks, one of these known complications where it truly was no one's fault, but again, they believe it was someone's fault, and they can't be told otherwise, and they will literally, these patients and families will literally drive themselves crazy. They'll drive their doctors and nurses crazy. They'll ultimately end up being ignored by the hospital. They'll also be ignored by personal injury lawyers. They'll go from law firm to law firm to law firm and be told by every lawyer out there that they don't have a case, that there was no error. There is no malpractice. They can't file a lawsuit. And sometimes they get so consumed in their anger, their grief, and their resentment that they will end up pushing away their own family, their own friends, their coworkers, or neighbors. And it's very sad. And it doesn't have to be that way, because the best thing you can do as a patient or family when it comes to known risk or a complication is to get an understanding of what are the known risks, the complications, before you engage in any surgery, any treatment plan, any new drug, any whatever. And it starts with something called informed consent. Informed consent. Anytime you engage in a new treatment plan, or are going to have a test or a surgery or whatever, anything outside a normal visit, if you will, with your doctor is supposed to sit down with you and have a very candid and perhaps uncomfortable conversation where they're going to talk with you about all the things that could potentially go wrong. Even if they do their job correctly and do all, their technique is perfect and the technology is doing everything it should do, there still can be these complications. Things can go wrong, and they should describe those things for you. They should talk with you about those things. Make sure you understand, and make sure you're okay. Make sure you can accept these risks. And if you can't, talk about any alternatives that are out there. Maybe they'll send you out for second opinion, or maybe you just go get a second opinion all by yourself. If the doctor really believes in a certain test, that you really need this test, or you really need to have this operation, and it has negatives, they should be able to explain to you why they think the positives outweigh the negatives. It has to be a very robust discussion. And it's okay to express your fears and share your concerns. And you yourself need to ask tough questions and blunt questions. Doctor, what can go wrong? What are the potential risks or complications with this test? Could I die? Could I be crippled? How might life be different in a negative way after this treatment plan? You need to ask these questions. You need to involve your family members or a trusted friend to help you weigh these pluses and minuses of this new treatment plan. Sometimes doctors and nurses will send you home with a video or a DVD or refer you to an online program. Take take that homework assignment seriously, and get back to your doctor with any problems or concerns or any questions. Again, the time to know or learn about a known risk or complication is before you do the surgery, before you do the treatment plan. You should never be surprised when a known risk or complication occurs. And the last thought I'll give to you, again, as I said in the first video, and as we talked about in the ebook, none of this should be considered legal advice. If you have any questions or any doubts about your case, as far as was it a known risk, was it a complication, or gee, was it maybe a medical error, and you're not sure, never should you hesitate to pick up the phone and call a lawyer. Go find a lawyer, talk to them, and discuss what it's all about. But again, I think you're going to be much better educated if you go into the lawyer's office with this understanding of known risk, complication versus medical error, and have a much better educated discussion with that attorney, with his or her colleagues, and you can really sit down and evaluate the care, and talking to a lawyer, get an outside perspective to see. So again, the time to learn about a complication, a risk, is before you do the procedure or treatment. You should never be surprised when a known risk or complication occurs. But if you ever have any questions about, was your case truly a known risk, or maybe was it an error, and in doubt, never hesitate to call an attorney, engage a law firm, and get your questions answered.